Hi, my name is Mariam Shodro and I am taking this video for the health assessment application number 2, and here is where I'm going to see my patient. Hello Mrs. Nian, how are you?
Good, thank you.
I am Mariam Shodro, I am your nurse today. Let me apply some hand hygiene and provide some privacy and hand hygiene. Can I check your ID badge?
Sure.
Would you please tell me your name, last name and date of birth?
Yes, Dylan Smith, 1st of April 1966.
That is great, thank you. Do you need to go to washroom?
No.
Are you comfortable here? Okay. So let's start with the reason that you are visiting the clinic today. So you have indicated that you have shortness of breath and ear pain and also sore throat. So with the shortness of breath, how severe is it and how long does it last?
It's not that much severe and lasts for like 10 minutes.
Okay. And do you feel pain when you are taking chest pain when you are breathing?
No.
Okay. And do you have any past history of the breathing troubles or lung disease?
No.
Okay. Do you smoke?
No.
That's great. What about the sore throat? Do you take any medication for that?
No.
Do you have a cough with a sputum?
No.
No. And with your ear, is it externally pain or internal pain?
External.
And how do you clean your ear?
I don't clean.
I don't clean your ear. Okay, that's okay. So I start with inspecting, and I will need to palpate at some point. Is it okay with you? Okay. So when I inspect the ears are equal size bilaterally, and they are aligned and they are symmetric, and I don't see any thickening, any swelling, and the skin color is consistent with the facial skin color. And okay, I will touch the tragus, pinna, and mastoid. Do you feel any pain?
No.
Tenderness? Okay, so there is no pain and tenderness. And now I would like to do a whisper test. Is it okay
Yes.
if you block one of your ear and wiggle it? So I say 3 words and please repeat.
Classroom, network, track,
Okay, that's great. So
basketball, volleyball, hand.
okay, that's great. So the hearing is equal in the both side. And now I would like to check your ear canal, the auditory external ear canal. And for that I use the otoscope and I take pinna up and out because as I have an adult patient. Okay, so up and out. Okay, so what I see is that the external canal is there is no erosion, and there is no discharge, and it is pink. And with the tympanic membrane, it is pearly gray, no bulging, no redness. Okay, that's great. And there is no discharge. There is no Okay, so now I continue with your nose. For the nose, I see that nose is symmetric. Would you please tilt up your head that I can, with some light, that I can check your nose? Very good. So this, so the turbinates, the nasal turbinates are moist and pink, and the sputum is in the midline, and there is no perforation, there is no lesion, and there is no discharge, no foul odor. Okay, that's great. And to test your patency, nasal patency, would you please block one of the nostrils and sniff? Okay, the other side as well. Thank you. And it is open, so the patency is intact. And I would like to also test your sense of smell. Would you please close your eyes and tell me what you smell?
Vanilla.
That is correct. So that tells me that the cranial nerve number 1 is intact. That's great. Now I would like to touch your face for the sinuses. The frontal sinuses, do you feel any pain?
No.
Tenderness? Okay. And do you feel any pain here?
No.
Okay. So there is no pain and tenderness for the, there is no cyanosis. Okay, now I would like to check your mouth, and I start with the lips. So the lips, there is no sign of cyanosis, there's no discoloration. The lips are pink, moist, no crackles, no fissures, no lesions, and it's symmetric. Okay, now can I ask you to say E?
E.
Okay, so the teeth are great. They are white and the gums are pink, no bleeding, there is no dental caries. That's great. So would you please say ah? Okay. So I see ovula. Ovula is in the midline and it arises along the soft palate. The hard palate is a bit whitish. Would you please extract your tongue? Very good. The soft palate is pink. And yeah, so the tonsils also are pink and 2+. Okay, so at the moment, would you please extract your tongue? Extract it out. Okay, thank you so much. So the tongue is pink, there is no whitish, there is no fissures, and there is no deviation, no tremors. And would you please, yes, rotate it to the side. Thank you so much. And would you please say tight,
Tight.
light,
Light.
dynamite?
Dynamite.
Okay, so now I can say that the cranium number 9, 10, and 12 are intact. 9, 10, and 12 are intact. That is great. So now we go to your neck. For the neck, I see that the neck is symmetric, is in this midline. I don't see any visible masses, and there is no thyroid enlargement. The trachea is in the midline, and I don't see any muscle atrophy. Okay, so I would like to palpate your carotid artery, which is between the sternum-mastoid and the trachea. Okay, it's very strong. It is 3+ and regular in return. The both sides are equal. Okay, that's great. And I would like to also auscultate. So I clean my stethoscope. Okay. With the bell of my stethoscope, would you please hold your breath? Okay, that's great, so that I can hear the carotid. There is no bruise. Okay, and now would you please shrug your shoulders against my resistance? Okay, and the rotate. That is great. The other side. That is perfect. So that is for the cranial nerve number 11, and I can say that is intact as well. Okay, now I would like to check the upper extremities. The upper extremities, I don't see any deformities. There is no involuntary movements. There is no skeletal deformities. There is no muscle atrophy. There is no lesions, no scars, and the skin is intact. And can I touch the joints? The skin and the joints are intact, and the skin is moist and flexible, elastic, and the joint, there is no muscle atrophy on the joint, and it's not hot or cold to touch, and the temperature is normal, and I don't feel any muscle atrophy. Would you please try to push your arm against my resistance? Thank you so much. So there is no muscle atrophy, the muscle strength is good, and I would like to check the nails. So the nails are they are normal in color. The angles is 160, which is normal, and the capillary refill is less than 2 seconds, which is normal. Thank you so much. So there is no edema on the joints, no swelling, and the skin is intact with the upper extremities. And I want to check your range of motion. Would you please stand up? Thank you so much. With the arms extended, would you please bring them up? Flexion. Thank you. 180 and bring them down. Upper extension. So that was flexion and upper extension. No altered range of motion. And abduction. Abduction. Very good. And For the external rotation, can you do this? Okay, internal rotation, can you do this? Okay, perfect. And would you please, for the elbows, let's do it like this, flexion, extension, that is great. And for the wrist, extension, flexion, very good. And ulnar deviation, radial deviation, ulnar deviation, and pronation, supination. Okay, that's great. So I can say there is no range of motion altered, and I didn't hear any crepitus, so everything is fine. Thank you so much. You can sit down. And sorry, before you sit down, please stand up. And I see the for the lungs and thorax, I see the anterior posterior to transfer is 1 to 2, which is normal. Thank you so much. You can sit down. Okay, now I would like to listen to your breath sounds. I go to the thorax and lungs. Before auscultating, I see that the lungs are symmetrical, and there is no deformities, there is no swelling, there is no lesion, no scars, and no deformities. I don't see any shortness of breath or any breathing distress or any accessory muscles used. So everything looks normal, and no deformities. Okay, perfect. So I start with the bronchial sounds, breath sounds. Please take a deep breath. Okay, take a deep breath. So bronchial breath sounds is very hollow, is very very loud, and it is a 3+. It is regular, and it is very high pitch, and that's great because it's normal. Okay, for a bronchovascular sound, I would use the first and second intercostal space, also right and left sternal borders. Please take a deep breath. Okay, that's great. What I forgot to say about the bronchial is that there is no stridor and no cracks. The same as bronchovascular, there is no cracks, no wheezes, no stridor, and it is a little bit lower in pitch compared to bronchial because it is inspiration and expiration is also equal. Now I go to the vascular, and I start with the apiece of the lungs. Please take a deep breath. Oh, sorry. Okay, take a deep breath. Okay, so this one also is lower in pitch, and the inspiration is lower than expiration. There's no crackers, no wheezes, and that shows that the air goes equally inside and outside. And now I would like to check the tactile phragmitis, which is for the vocal vibration. And when I touch your chest wall, please say 99.
99, 99, 99, 99.
So it shows that the tactile phragmitis is equal along the lung. And for the expansion, also I put my thumbs under the occiput process. And please take a deep breath. Okay, another one. Okay, so the expansion is also symmetric, and it's perfect. Okay, thank you so much.
Thank
That was
you.
it. Thank you.